start. Thank you for joining us today. We really appreciate you spending your time, your lunch hour with us today for this webinar with Rosemary Kohr. We've got 1 hour of discussion and presentation ahead of us, so let's get started. This is Tanya Sherry from the Health Leadership and Learning Network in the Faculty of Health at York University. And we are the Continuing and Professional Education Unit in the Faculty of Health. Today we're hosting a webinar, Stepping into Long-Term Care, Best Practices for Client-Centered Care. And this webinar was focusing on people who are re-entering or entering to support long-term care during this time of COVID-19. Just a few pieces of etiquette. As we're online, you'll notice you're all muted and you don't have video at this time. We ask you to keep your video off just to make sure we've got bandwidth. Now, if you would like to ask us a question, there is a chat option for you in Zoom. If you're not familiar with Zoom, there is a black control bar which has a little chat bubble there that you can open up. Let's get started. I'd like to welcome Rosemary Kohr. She is our speaker today. Rosemary is our program director for our wound care program suite of courses, as well as our patient navigator courses. And Rosemary comes to us with extensive and deep expertise in not only teaching at the university and postgraduate level, but also in teaching with nursing education. And Rosemary currently resides in New Brunswick, so she's joining us from Eastern Canada, and where I can see it's sunny today. Rosemary also has extensive experience in working with long-term care and service organizations that provide in-home care to people who are vulnerable or elderly. And with that, I'm going to throw it over to Rosemary Kohr. Welcome, Rosemary.
Thank you. Thank you, Tanya. And I hope everybody can hear me all right. We had some issues this morning as well, or today as well. So thanks everybody for coming to this. And as Tanya said, we don't have slides. I believe this is going to be recorded, so that's one thing. But the other thing too is I really wanted to hopefully have an opportunity for some conversation and some discussion. So, that's why you have the chat to respond through, and Tanya will be kind of fielding those responses, and we'll be kind of opening it up as well to that. So I really want to start off by just saying, we really need to congratulate and thank all of the people who are hard workers in the healthcare sector and who have been working with the kinds of issues that have come up with this pandemic, that the providers, the care providers, the administrators, and the families of patients, residents in long-term care are really trying to do their best in a very difficult time. And long-term care has once again kind of popped up into the news quite a bit. In terms of the complexity of caring for fragile residents in that environment. And that's really across the country. So it isn't sort of one specific location or one long-term care facility that is, the sort of being targeted. This is something, and the other thing I think from my perspective is this is something that certainly has been going on for a very long time. So, it's the stress, I guess, related to the pandemic is something that has just really highlighted the kinds of issues that have been, that have plagued long-term care for a long time. So, about 15 years ago, I did some consulting with some long-term care facilities, some agencies and organizations. And, one of the things that really came to the fore was the way long-term care is regulated by the government. So whether it's the for-profit, or what we've called the sort of for-profit, or the not-for-profit long-term care facilities, they all report to the Ministry of Health. They all report and have to follow the regulatory process that is embedded in all of the long-term care legislation, and it's significant. So if you've ever had a chance to look at any of the documents put out by the government, you will see that long-term care, the 15 years ago, we were kind of joking about the fact that long-term care was the second most highly regulated institution or organization in Ontario, and the most regulated is the nuclear industry. So, that kind of sets it up for what is in place. The downside of that has been, with the regulatory constrictions, there have also been a number of issues around funding models that have been available for long-term care facilities. And again, you can go to the Ministry of Health site, and you can see under the long-term care regulations, the actual costs are listed, so that you can see kind of the cost for long-term care for a month of care, how much goes to what's allotted for food, for example, what's allotted for ancillary services. So, the kinds of additional things that people have when they're in long-term care, whether they're living in a single, if they have a private room or a semi-private room, there are a number of different components. So, we have to really look at that environment, I think, and identify that there are a number of aspects of the long-term care setting that really are kind of up for a change. So, I look at the pandemic, and I've talked about this before in some of the other webinars and, other situations. And really, I think the pandemic offers us opportunity. So we can look at it as being a crisis, and for sure it is. But I think the important thing is to take a look at what are the positive outcomes that we can really learn from, and that we can take advantage of, because it really is a time when we can begin to start examining what is it that we are doing that we could do differently, we could do better. And, I think we can do some of these things better without spending a lot more money, but maybe just the redistribution of, how our healthcare dollars are spent. We can start looking at some of those things. So, the first thing really that I want to mention and talk about a little bit, and again, when I looked at the participants for this webinar, you come from a variety of backgrounds. Some of you are looking at, as Tanya said, looking at sort of maybe branching into long-term care. Some of you look like you are already working in that environment from either a administrative point of view or from a clinical point of view. So, some of you are educators. So there's a lot of potential for some really interesting discussion here. But, I think one of the first things that we have to recognize is the requirement that we have a safe environment. And safe environment is, we need to know what that means. So safe environment means ensuring that, the personal protective equipment is available for people and that people know how to use it, that it's appropriate, that there is safety on the job. So people who are coming into a setting where they're concerned about their own health, This is something that needs to be looked at. And people need to be protected. So workers need to be protected, as well as the residents and their families need to be protected too. So we have to kind of look at the whole picture. And the other thing I just want to mention about that is the fact that when we're talking about environment, the person who really got the ball rolling on considering safety in the environment and keeping things clean, I'm sure those of you who are nurses will recognize that yesterday was actually the 200th birthday of Florence Nightingale. And, Florence Nightingale is one of my heroes, and she certainly was one of the prime movers to look at hand washing and just basic hygiene. So I think that a lot of what we really need to do is not get as anxious about, do we have N95 masks, but really to think about what are the basic kinds of hygiene that we need to pay attention to, and how are people, how do people know about this? How are we educating the public? How are we educating the people that we are coworkers, and also the residents, so that there's a much better understanding of what needs to be in place. So it's not, in my view anyway, it needs to start with simple things like hand washing, for example, and just being really aware of, when gloves are being used, that they need to be changed. Cross-contamination is a huge issue. Any of you who are going to the grocery store or anywhere else, that people are not doing what they need to do. And the problem with that is that there is a sort of false sense of security. Well, I've put gloves on, so I'm safe, when in actual fact, that isn't necessarily going to be the case, or the same with a mask if it doesn't fit properly. So just being aware that sharing information around that safe environment is one of the keys that we really need to pay attention to. And sharing the information, like I said, with coworkers. So, you have a number of different people who work in long-term care. You have the regulated healthcare professionals. You have an RN group. So you might have a nurse practitioner, you might have some registered nursing staff, RPNs, you have personal service workers. So everyone physicians, every dietary, everyone has a different level of knowledge around what it means to be safe, and what it means to maintain proper hygiene. So it is really important to make sure that those are the kinds of things that, first off, need to be in place in long-term care. So when you're looking around the long-term care facilities, what are you seeing? How is that information being shared with people? And I know that the Premier in Ontario and the Minister of Health have been talking about training for staff. And again, this is not new. But the important thing is, how is that training being provided? And how is it then being reviewed to ensure that people are actually doing what they need to do? It's one thing to get the information. We all know that, it's one thing to get the information, but it's another thing to know that you're actually doing what it is that you need to be doing. So, I think that's something to really pay attention to. The other thing too is that we need to maintain a level of transparency with the families of residents, and with the residents when they're, cognitively intact, and this can happen, to really share information. And sharing information means, giving people information in a way that they can manage it. So handing somebody a brochure and saying, this is what you need to do to wash your hands, or to maintain that social distance, sometimes that's not enough. There needs to be that demonstration, that teach back perspective. So a lot of the kinds of things that take time need to be in place. So you do have to take that extra bit of time to make sure that we're all on the same page. Are we all doing things the same way? You know, that's the important thing that we have to make sure in order to ensure that safety, kind of safety first thing happens. Um, the other the other thing too is to really recognize some of the resources that we have available. And actually, interestingly, I just got an email yesterday from the director of the Centre for Effective Practice in Ontario. And their website is full of a number of different resources that you can access. And what we're going to do at the end of this is, you've all, registered for this webinar. So what we're going to do is actually put together a list of resources and send that to you so that you'll be able to access those yourself. I figured that was probably the easiest way to do it. So the Center for Effective Practice has a lot of excellent resources, including things like, how do I go to work in a long-term care facility? How do I protect myself? What are the, what's a checklist that I maybe need to pay attention to when I'm going into work in that environment? How do I use personal protective equipment? So all of those kinds of things are resources that we really need to, to take a look at. And yeah, Tanya, I'm seeing that you're asking people, if you have resources, please, send them, put them in your chat bar and or send them to us so that we can add those to the list. I think this is where these webinars are really effective, is that it's, it is a way of sharing information. So, and this gets me kind of to my other thought, which is around communication. And it's really, this is something I think that came up very clear early on across the country. Was that communication from the government, from the science, from the Center of Disease Control, from all of the places where we really needed to get accurate information. Sometimes the information was not as clear as it could have been. So as I said before, what does it mean when we say social isolation or social distancing or quarantine? What does that, at this point, we're kind of 2 months or so into things. How are people understanding what that means? And we're all living that, we live that life. So ordinarily I come to Ontario to teach in the spring and in the fall with York, with the Health Leadership and Learning Network. And, this spring has been a very different one for us as well in terms of offering all of our programs online. So, and I'm sure you're experiencing that yourselves if you're taking courses or if you have, kids at school or university. It's a different world right at the moment. So I think one of the big things is to communicate to the families of residents in particular. I would say that that's one of the key things that we need to really pay attention to, because, families at this point are very anxious. If any of you have, family members or have friends who have family members who are living in long-term care, people live in long-term care for a reason. It's not a retirement home. This is a place where people are living because they can't manage. They can't manage on their own. Family can't manage with them at this point. They need the requirements are too heavy or too great for them to be able to, to stay home or stay at home. And so when you kind of layer all of the things that are going on, you can really see that the stress level that people are experiencing is huge. And, a few weeks ago, there was a big push for people to say, with the all of the news that was coming out about, the sort of lack of safety in long-term care facilities, and and I'm not minimizing this, but what I'm saying is that the kinds of message that came out was I should take my family member out of long-term care. I should bring them home, because if I bring them home, at least they'll be safe. So, the minister came out with a list of kind of a checklist to look at in terms of, is this something you can realistically do? And having worked for many years in, as an acute care nurse practitioner in acute care, but also having done consultation with long-term care and home care, I really understand the family anxieties, but I also recognize the requirements of many of these individuals who are living in long-term care that are just not, families are not able to manage this. So we have to really be able to have good communication skills. We have to really understand how we can, how we can talk to people in a way that is going to allay their anxiety, but also recognize the reality of that level of anxiety. Why is it there? That there is, and people's level of stress is not only around their family member who is, potentially in a long-term care facility where they can't go in anymore. They can't go in to check to see how mom is doing. I have to base that on what I'm being told by the healthcare providers who were there. Depending on how easy it is to talk to your family member, this can be extremely stressful for the person who is outside the window, who can't get through the door. And the other sort of components of that are the level of stress that families are experiencing, individuals are experiencing just in their own lives. So, it's the same sort of thing when you look at your own situation of, are your kids at home? Are they, climbing the walls because they can't go to school? They can't be with their friends. Their play outside is limited. And they're anxious, and you're working at home, and your partner is working at home, and all of the other sort of, you can't go to the movies, you can't go out, all of the kinds of stress. And do you have are jobs going to be there at the end of this, assuming, seeing whatever's going to happen. So, you have to really think about the stress level that people are experiencing and the kind of, how do people respond to stress? So what do? They get angry. They take out their frustrations on the care providers, you potentially. And, again, I'm not trying to sort of make this as the worst possible scenario, but just to bear in mind that your approach can make a huge difference to how somebody responds or how somebody reacts. So, you can have somebody who is frustrated and upset, a family member who's frustrated and upset. But the point here is that we, as the healthcare providers, need to have really good communication skills. So I would say that, we don't have the time to kind of go into the whole level of communication skills that we need to be considering. But when you think about, effective communication, it's really about listening, isn't it? Like paying attention to where people are coming from and how you can help resolve the situation. So that's one of the things, and maybe we can take a couple of minutes because it looks like some of you have some pretty interesting things. Tanya, is that?
I've got a comment here, and just thank you, Rosemary, for pointing that out. From what I'm hearing is that as healthcare providers, whether you're the RN, the DOC, the RPN, the PSW, whoever it is, you're reflecting on the fuller picture of what is happening in the lives of the families and their connection with their loved one, with your client, to give you a better understanding of what they're experiencing, because that will come through in how they communicate
Mm-hmm.
with you, the healthcare provider, and to be sensitive to the fuller picture, because it does impact how successful your communication with them will
Mm-hmm.
be.
Yeah, absolutely.
Yeah. And that listening skills, listening skills are important. Rosemary, in your experience, um, by using maybe more active listening skills or communication, any other pointers that you would give to, healthcare
Mm-hmm.
staff members if they are communicating with family members who are really, really upset and it's on the phone?
Mm-hmm.
Yeah. Any
Well,
other thoughts?
yeah, I think one of the biggest things is being able to, and again, not going into sort of a whole course on communication skills, but,
Right.
to not take it personally. I think that's probably the biggest thing, is to recognize that it's not you that they're angry with, it's the situation. So it's that situational stress that is creating what's going on. So to listen to that, not get defensive, to really kind of say, I recognize that this must be very stressful. This time must be very stressful for you. And, I'm here to help. What can I tell you? How can I make this work better for you? Some of the things that I think we need to begin, what I said at the beginning about, looking at this as a kind of an opportunity, is really thinking at what can we do to help families communicate and know that their loved ones are okay. So, some of the things are looking at window visits. How can those be arranged so that families can actually see each other? That is certainly one thing that could work. You have to really start to think outside the box. I think that's one of the keys to being flexible with how we're making this work better. So think outside the box, using technology. So what are the sorts of approaches that we can take that are going to help people connect with each other? Everybody has a phone, everybody on the outside world. So, people have cell phones, they have the ability to communicate often. They may not use them that way. So, for families that have Facebook or have other kinds of messenger services where they can actually have video, this is one of the times that we need to really think about how can we pivot pretty quickly to make that experience happen, so that if somebody wants to call in to their loved one, that if the resident who's in the long-term care facility doesn't have their own phone, for example, is there a way of having, phones or an iPad or something like that in the facility that's accessible to people, so that the resident inside can actually see see their loved one as well, see their family member, their loved one as well, so that, there can be more of that kind of communication. All of the approaches that I would assume you may be using yourselves. So, Google Hangouts, Zoom, Microsoft Team. I mean, there are a number of different approaches that you can use, but all of these are really fairly accessible. And if you know anybody who's, under 25, they can probably help you set them up if you don't know how to do it yourself. So, I just encourage you to think about how can we go into the long-term care facilities and help with that link, with that communication link, because that really is something that is going to help family members feel like, they have some control over what's going on. Because part of what's happening is that we really have very little control in terms of even understanding what this virus is all about. It's a different virus from many of the. It's a coronavirus for sure, but it has some characteristics that are very different from some of the other purely the respiratory viruses that we've seen in the past. And so we have to really think about, and we're constantly getting new information about different effects of the virus itself. We know, however, that seniors, people who are immunocompromised and people who have fragile health are definitely at higher risk of serious complications complications from this kind of a virus than someone who is in, prime health, for example. So, but, we all need to be cautious about this because, again, the issue is around transmission of the virus and how that happens. And again, it's still not entirely clear as to, yes, it's airborne, it's aerosolized, but to what level is that? Is it one hockey stick away from each other? Is this sort of what we need to do? So I think what's important is that we don't have all the answers, and we need to just be cautious, I think, err on the side of caution, and be cautious in terms of the kinds of information that we're getting as well. So, I urge people always, for whatever it is, to look at, what are your trusted sources of information? So, evidence-based research is always great. We don't, it's very early yet to have a lot of peer-reviewed, carefully documented information. So it's going to take some time to get that. So that's part of what we need to be sharing when we're talking to people who say, well, it's this, or, it happened because of this, or, laying blame in a particular situation. So I think that's hard. The other thing that's difficult is the fact that we're getting different messages from different places in terms of what can be open now, what isn't open. So, I live in New Brunswick, where we now are able, because it's a small population and we're very spread out, so we haven't had the same issues that Ontario has had, for sure. And, so the allowances that are being made in New Brunswick have no bearing on what's going on in Ontario. And so you can't look at another place and say, well, they're doing it, so why can't we? So, I think that those are things that we need to, to really share with families, that we don't have a lot more information than, than what the government, what the Ministry of Health is really laying out for us. And I think that they're actually doing a pretty good job in terms of providing that information. So, I think communication is a key area of concern. And thinking about, I'm wondering, those of you who work in long-term care, are there strategies that you've been using that work effectively to, or that are working at least partially effectively to, to help people, cope with what's going on?
We do have someone who submitted something, Rosemary, to that effect. She says, or this person says, there are many seniors in the community who are cognitively challenged and cannot use a cell phone. In working with such individuals, they are encouraged to have a house phone unit which provide for a low level of navigation. They simply recognize the ringing and pick up the phone or input the numbers to dial out their calls. So again, it looks like a community setting. People who have cognitive challenges maybe could even extend to those with various forms of challenges as well. Any thoughts on that, or any ideas?
Well, I would agree. I mean, I think that that's one of the, we're talking about long-term care, but there are also people who are waiting for long-term care beds in the community. And a lot of the resources that they have had available to them, like, the adult day programs, for example, have not been, have been closed for obvious reasons. So, how are resources being made available for people who are potentially either living with someone who's got cognitive issues, senior with cognitive issues? How is the community able to respond to that? And I would, I don't have the answer for that, but what I would say is that these are places where the resources that you all have in your own communities can really mobilize. So, I say this a lot in the patient navigation courses, that we really need to begin to expand and look at what are the resources that are untapped in the community. So church groups, for example, or, because again, churches, people in church groups are not getting together for church in a physical setting anymore, or at the moment. So, and there are many people who would like to help. So how can we access those members of the community in a safe way so that they can also be providing or helping out during this time? So I would say that there's a lot of, it's that thinking outside the box kind of approach that I think we need to be looking at. And there may be opportunities for people to provide volunteer services, for example. Or, I've seen where nursing students and medical students have been, kind of stepping up to the plate to provide services. And it's a learning experience for them too. So it's a great kind of opportunity to learn while you are doing something valuable for your community. So, those would be the things that I would be encouraging people to do.
There's a little bit of crossover here then with our patient navigator discussion, everyone, that we had a couple of weeks ago around the use of the community and reaching out to various areas in the community. Yes, like spiritual groups or similar or other groups that could potentially provide additional support, whether it be to family or to the client or to the person. And I recall also in the past working with DOCs, Directors of Care, for everyone, sorry if I'm using that acronym, they're Directors of Care, where there has been or is outreach to community groups or nonprofits or community, maybe spiritual groups who are connected to the long-term care facility and could provide support. Just some ideas. I know I'm sure you all have a plethora of ideas, and I see them coming through. Extra volunteer staff to assist with sessions. Some people want the comfort just to see their family resident for peace of mind, even if the client cannot speak. Using portable iPads. And someone else saying, our church puts together a Zoom virtual cafe every Thursday that helps isolated seniors meet and chat while at home. Yes, issue with tech savvy, but lots of members willing to help set up. And another person says, I'm a physiotherapist, and I feel due to the distancing and minimizing the contact, it is really getting difficult for residents to maintain their physical functions for like ambulation, improving their tolerance levels in functions.
Right. And actually, that's a great segue into, talking about some of the actual issues that people in the residence are dealing with. And, you bring up a really good point and I'm going to talk a little bit about, what that looks like in the next couple of minutes. But, to really start to think about what are the ways of maintaining, because, we're talking about keeping people safe, right? And so keeping people safe means optimizing their health at the level that they're at. I mean, we know that many people in long-term care have chronic disease issues that, we're not going to solve, but at least we can prevent them from deteriorating. And, this sort of, when I put on my wound care hat, to talk about, what are the things that we need to have in place, because I don't want to see somebody with skin breakdown or a bed sore, happening. And some of the things are around nutrition, for example. So, if people in long-term care, I mean, again, sort of thinking about the change in routine that people are experiencing, the residents are experiencing. People with dementia, for example, are often very focused on the routine. So if that routine is disrupted, it creates real issues, and it may result in things like, someone not eating because that process has changed. I'm not going down to the dining room anymore. I have to eat in my room, or, whatever the situation is. So those are the sorts of things that we need to be aware of. We need to still pay attention to the fact that people need to have good nutrition. You're not going to, and again, I recognize that in long-term care, the limits are around the amount of, the sort of funding pocket for food. But also to think about, what are we able to do from that perspective? But changes in routine are going to affect eating. They may affect level of anxiety. Like I said, sleep is another thing. And often, again, people with dementia and elderly people in general may have, different sleep patterns. And if these are disrupted, what does that do to their own health? But how does that also impact on other people in the facility? So other residents wandering, if this is something where you have people that really need to get up and move because that's part of their dementia, this is something also that needs to be addressed. And even if it's difficult so there need to be ways of addressing this. And I'm not the expert in that respect, but I think what's important is that there is expertise in the physiotherapists, the occupational therapists, the recreational therapists, music therapy, art therapy, the people that can really put their heads together, even if it's virtually, put their heads together and come up with some strategies that can help, that can help make that happen more effectively. So, for example, I know that the YMCA, at least here in New Brunswick, offers, they're now offering virtual classes online so that you can access different kinds of classes. Those are the sorts of things. What are things that could be done with existing staff or staff who are in the facility, who can maybe lead those residents in some activities, even if the therapist isn't available, for example. So some of the things particularly people who are confined to wheelchairs, or use walkers, they still need activity. We can't sort of close people into their room and say, well, you can't come out. I mean, we have to strategize around how to make this work better. So what can help? Music is something that certainly should be thought of as a therapy that is very effective. Tactile kinds of things, so simple puzzles, things that are simple to do. Crafts, art, memory books, photos, it's an opportunity to potentially engage with residents in a way that, and because time is a little different right now, it's perhaps an opportunity to think about how can we engage in these activities with our residents in a way that will be, that may be over a period of time. So, it could be 10 minutes or 20 minutes, as opposed to, a full hour of a session. And we need to reinforce the engagement so that there is that social engagement, the potential for social engagement with the residents so that they don't feel isolated. because they already do feel, they're going to feel isolated, whether they are cognitively intact or not. This is something that just at that sort of visceral level, I'm sure is an experience that people would have. So I think the other thing too is if you're working in long-term care, it's an opportunity, I see it anyway, as an opportunity to take some time to, yes, you have to deal with the physical, safety concerns. You have to make sure that activities of daily living are managed, the cleaning, bathing, etc., nutrition, etc., but also to take the time to, get to know the residents. I think that's one of the real strengths in long-term care, is that long-term care means that you have people who are there for however long they're there, but it could be a year, it could be 2 years, it could be 10 years. So, I think that that's one of the real strengths of long-term care. And I know myself, and any of you who are nurses or other healthcare professionals, that, well, I don't know if this was your experience, but certainly, when I started in nursing, working with seniors was really not my thing. I really, and I know that having taught a lot of students, I know that their area, they're really interested in the ICU, they're interested in emerge, sort of critical care and trauma. But the reality is that when you're working with seniors or older people, you have that opportunity to find out these amazing stories about people's lives. And it makes you richer, to have that experience. So I think part of what I think is that long-term care should be, in many ways, would be a wonderful starting place for people who are coming into a healthcare profession, as sort of spend a year or two working with seniors, to really have an appreciation for the lives that they've lived and the contributions that they've made. I think it's the other thing that's really essential is to support the families from a distance, and to really identify strategies, to really sit down and sort of problem solve as a group. Again, if it's a virtual group, if it's the DOC, the director of care, and the staff, it should be everybody, not just nursing staff, but really should take in everyone to really sort of think about, how can we make this work? How can we make, someone's having their 100th birthday, how can we still make that a celebration even if their family can't be there? So, those are the sorts of things that I really think we need to pay attention to. So,
Rosemary.
Yeah.
So just to from what I hear you talking about, there is inherent to long-term care, perhaps anyone living in a care situation, whether it be for seniors who are more mobile and active and living more independently, through to people who are far more vulnerable and ill, there is deeply embedded in working in these areas is this social emotional factor that that includes family members or anyone who is a loved one, and entwined within the care of, like, the care of the body, or the care of keeping their body well, that is just running through this long-term care system. And as a care provider, when you're walking into it, if you're brand new to it, that can be something that is probably maybe a very exciting part of the role, but also can be one of a deep challenge for the role, because the communication required and the relationship building required with family members, as well as with the client themselves, runs much deeper than maybe other care situations we have across healthcare. Just some thoughts on that, of what I've said about this sort of a social emotional space, and well-being, this emotional well-being as well.
Oh, absolutely. Yeah, absolutely. And you know, I think one of the things about long-term, I mean, long-term care has had sort of a bad rap, you know, for a long time. And you know, people talk about the difference between the for-profit and the not-for-profit homes. And you know, I think we really have to recognize that no matter what the long-term care facility, they are still functioning under the Ministry of Health guidelines, and they must do this. So, you know, I think it's up to us as care providers, whether you're a housekeeper or, you know, the director of care, but everyone really needs to pay attention to the fact that, you know, these are not patients. These are not, this is where people live. And it's important to recognize that it's where someone lives, and they should have that respect and that dignity to be able to live in this setting, because it may not be a setting they've chosen, but this is where they're living. So how do we make this the best possible living space for somebody, and how do we ensure that they're still, you know, engaging as much as possible, because the families are often, you know, they're shuttered out at the moment. So how do we really, this is kind of a time to really think about how do we make this so that families are able to be more engaged. So, you know, like I said at the beginning, I don't have the sort of solution or solutions, but I encourage anybody who is either thinking about working in long-term care or is currently working in long-term care. You know, I recognize that it is a very challenging environment. It's all, in many ways, is more challenging and you know, has a lot of kind of control issues that you need to be aware of than other settings. But at the same time, there is this real opportunity to have, you know, because really what you're doing is you're providing care and support for somebody who's living in that environment, but also their family at the same time, right? So it's not just the person who's living there, but it's their community that we need to pay attention to. So I realize that we are getting close to the end of this
We
session.
are. We are.
Right.
I just want to summarize. A few people have sent in some thoughts. Um, One person is saying Alzheimer's Society of Toronto is providing support to families as well. Okay, thank you, Mario. We're going to add that to the list. PT has said, I'm concerned, just as we were saying, concerned that these early dementia seniors who are living alone in this pandemic and their well-being, it must be even more confusing for them. Some families have pulled out the PSW to decrease the safety risk due to movement. These families do keep in touch by phone, but is this enough to keep seniors safe? And then someone has responded, I call these patients a few times per week for 30 to 60 minutes to check in on activities of daily living and just chat. But half of my patients have canceled their regular PSWs. So that's another loss of social interaction. So you can see the consistency in that this sort of social emotional space is so vital. Someone else is commenting about caretakers, and spouse who is looking after the dementia person in their home are also
Right.
isolated during the pandemic. Family members unable to come in and help them is also a big stressor. Are student nurses scheduled for rotations in LTH facilities as part of their training? Oh.
Right.
Well, right now, all of those practicums are on hold, but I think there's lots of student nurses still volunteering. Um, but you can see, and everyone, please do send in your resources before we sign off. I want to make sure we remind you, send in any resources you have available that you would like added to the list. We have the RGP, Center for Effective Practice, the Alzheimer's Society, and the one we mentioned earlier so please do email them to hlln@yorku.ca. I'm going to put the slide up. There's our contact info. Let us know if you have any resources you want to share with this group. some caregivers, SRI, have moved into homes and staff rotations 2 weeks on, 2 weeks off, isolating 14 days between staff. Everyone's sort of doing, reworking it, aren't they, Rosemary? They're sort of
Yeah.
reworking the process or systems they have available to them.
Yeah. And I think that that's what's really exciting is that, it's a challenge and it's awful on one level, but on another level, it's really, it's shaken us up. We really need to think about different ways of doing things. So, this kind of webinar, I think is really, personally, professionally, I think it's very helpful to be able to talk about or think about, some of the things that we could be doing differently. It's a process. This isn't something where somebody has kind of a plan that we can put in place and will work effectively, because we don't know what's going to happen. We really don't know what's going to happen. And I think the best thing is to communicate, is to really work together. So that's kind of my, if I'm thinking of a message or take home, is to say, we need to communicate, we need to work together, we need to think outside the box, we need to think of different ways of making everyone safe and, optimizing people's health. So not just the residents, but as other people have mentioned, family members, people who are in the community, people who are at risk in the community as well. So how can we do that? What are some things that we can do? So that would be what I would say. Think about that. And in your own organization, think about, or your own circle of care, think about how you can make that happen. So I want to thank you for being here, for paying attention, and for contributing as well. And we will be putting that resource list together to send to everybody. So, these are the kinds of webinars that I think are useful. So I'm hoping you did too. So thank you for being here.
Thank you, everyone. And thank you too. I'm going to echo Rosemary's thoughts about you being resourceful. Everyone's typing things in that they've been doing. Being resourceful with your teams on your own for the best interest of your clients and their families. Thank you. We've got some more. We've got Behavioral Supports Ontario, /brainchange.ca as well. Thank you for sending that. So I echo the words of Rosemary in terms of thanking you for your innovation. Thank you for doing what you're doing, for being brave, being out there, and for keeping our very vulnerable and precious people in their senior years safe and well. ChemH Echo Project. Thank you, Therese. Thank you. So again, yes, we're going to compile this list and send it out to everyone. If there are resources that you can't have a chance to type it into the chat line, please send them to hlln@yorku.ca. It's right in front of you. And we'll also have the video available later this week or early next week as well. Thank you. Yes, thank you to everyone too. Thank you. And we'll sign off for today. Please be well, take care, and hopefully join us for another future webinar. We'll keep you posted, everyone.